Tonight's topic is on emergency and disaster preparedness. This is a really important topic in that we can all be affected by disasters that may have some warning and may not. And when I met Dawn Bailey for the first time a while back, I learned so much speaking with her about what opportunities may be available for families of children with medical complexity, and also the wide gaps in terms of what is available to support families. So we are going to learn a lot from her expertise. She has seen and met and learned a lot herself. And we also have parent Bernadette Garrett joining us this evening as well, who will share some of her experiences living through some natural disasters with her own family. Before Dawn takes over and starts with her presentation, though, we'd love to launch a poll to learn more about how you all feel as either providers or as parents when it comes to emergency and disaster preparedness. Allison is going to launch a poll question for us. You'll see there are 6 possible options, but 3 apply to providers and 3 are for parents to respond to, and we would love to have a better sense of your comfort level as it pertains to emergency and disaster preparedness, supporting either your family or your patient families who have children with various medical complexities. So please enter your responses. Thank you. It looks like almost 3/4 of you have responded already. I don't think anyone is saying, well, there are a few of you saying comfortable, a few providers, no parents saying entirely comfortable, which is not unexpected. Thank you for sharing, and feel free to continue to complete those. I'm going to mute myself and hand it over to you, Dawn, so we can get started with this evening's presentation.
Thank you, Chrissy. Welcome, everyone. Give me just a moment to share here. Right. Can everyone see the slides okay? Awesome. Thank you. Great. Well, thank you, everyone. Welcome. Thank you for the time this evening. Reading all of the welcomes in the chat. Appreciate the time from home, from the hospital, wherever you are. I was so honored when Christy had asked me to talk about this topic with in the room with Courageous Parents Network. This is an area, I keep getting the poll, Chrissy. I'm sorry, it just keeps popping up on me.
Okay, no problem. We'll try to fix that. Thank you.
Yeah. Sorry, it's distracting. But I think this is an area, as we are seeing more and more events happening, whether it be natural or other type of events, that families like ours that have children with medical complexity have even greater areas of focus that we have to be thoughtful of, and really needing to be sure that we know how to ensure the care and well-being of our loved ones are met as best as possible, should any of us have to encounter activities like those. So let me see here, apologies.
And Dawn, my apology, I forgot to ask you and Bernadette to introduce yourselves.
Oh,
You're
yes.
about to do that, so
Yes.
go ahead, if you can do that, and then we'll ask Bernadette too before you dive in.
Yeah. So again, I'm Dawn Bailey. I come to this mainly, I'm a mom first and foremost. I have a 20-year-old daughter now who was born with a rare genetic condition. She is very medically complex with significant developmental and physical disabilities. Requires that full care kind of hospital at home model to be at home. And I've had the privilege over the last 10 years of taking kind of that lived experience, if you will, and apply it as a consultant for various state and federal programs that help support families of children with special health care needs and those with medical complexity. So, and Bernadette, I'll turn it over to you to introduce.
Hi, I'm Bernadette. I'm the mother to a almost 6-year-old daughter, also with complex medical needs, who was surprisingly born with a non-functioning upper airway and required an emergent tracheostomy placed at day 1 of life. So we have a mini ICU as well. But she's currently been undergoing several airway reconstruction surgeries. So the care, the needs, or complexities are constantly evolving.
Great. Thank you. Great. So, to kind of lay the groundwork when we talk about disaster preparedness, I think we always kind of talk about, sunny in the emergency management realm, there's always kind of a talk about your sunny days and your rainy days. And so I wanted to just kind of level set that on a sunny day, this is kind of what it looks like for my daughter. With a lot of support and a lot of behind the scenes, we're able to get her out into the world and the community and live life in a way, that gives her a chance at everyday life with school and friends and different things. And then we have our not so sunny days. Let's see if I'm having. So then we have our rainy days, right? And in our world, oftentimes rainy days means when the medical crises hit, right? And that can happen on the sunny days. We can start a sunny day and then we can have a rainy day within a couple of hours. And that can mean some, emergency room visits. It could mean hospitalizations. It could mean unexpected surgeries or unexpected ICU stays. And so families like ours, I think, are often already very, very prepared for kind of unexpected disasters, if you will. And so a lot of times when I'm sharing our perspective in this, I try to convey the notion of what does a disaster look like for us? And the reality is, families of children who have special healthcare needs or complex medical needs really face some sort of a disaster on almost an everyday occurrence. It can range from the type of disaster, but we all have to pivot. We all have to scramble. We have to adapt. We have to shift gears. We have to triage. We have to care. We have to do all the things pretty much on a daily basis. But that expertise isn't always thought of or translated when we think about how to work with families like ours in the disaster and emergency preparation space. The other challenge that we have is families like ours typically have to rely on a multitude of systems and resources just to have our day-to-day function continue to happen for our loved ones. So, I'm sure everyone can relate to you've got your clinical management between all of the doctors and the appointments and the follow-ups and messaging in the portals, and then you have your prescriptions and your refills and which ones need prior authorizations. And some of us have compound and specialty. We have a multitude of DME products and we have to navigate different agencies and DME providers. And then through all of that, we know the role and the challenge that insurance plays in each of those areas. And then we have the education setting and we have our community and our home and community-based services realm. And when disaster happens or interruptions happen, we don't always recognize that any interruption in any of those areas can be very detrimental to the ongoing function of care for our loved ones and our families. And those entities aren't always thought of or considered in the broader emergency management space. And so there's a lot of effort and work now being done to focus on those areas and to help bring that awareness and try to, I guess, broaden the table to ensure that as communities, whether it's local, county, state, or federal, are working on emergency and their ESF functions, that they're being thoughtful of some of these other entities that need to be part of that discussion for populations like ours. Oh. So a way that I help highlight this is I use what's called a care map. And so this is my daughter's care map, and this is what is kind of maps out all the different systems that I have to navigate day in and day out just to keep her everyday world functioning. And this is going to look different, a little different depending on, where you are, which state you're in, and kind of how your state system structures are. But for where I'm at in Arizona, this is kind of how our state system structure works. And so you can see that I have several boxes of areas that I have to navigate to keep all the different areas of my daughter's world functioning. The unique part of that is you'll notice there are no arrows in between all of the boxes. So there's no integration or collaboration between each bucket. The commonality of arrows is between myself in the individual and family within each, meaning that the driver of keeping all of that in balance and all of those plates spinning really falls on the family, the caregiver, the parent to make sure that that happens. And that's just every day. And those of us that do that would tell you that it is often more than, but a full-time job in and itself. So any disruption to any of these will have a ripple effect on the ability to maintain that constant care for that individual. And so these are the things that I think are important as families to know what areas do we need to be more thoughtful of and are more challenging for us to prepare for personally, and who is our support and who do we need to be able to help us during that. And then how do we help bridge that gap within the emergency management space of how can those supports and resources also rise to be able to be there to support families like ours. So we talk about alternative planning, right? And so in my space, I showed a couple pictures here. These are kind of our medical cart that we have at home for my daughter's monthly infusions. And then there's a picture on my dining table of all the equipment and supplies that we gather just to do like a 2 to 3 day trip, like up to our family cabin. So this doesn't include all your other basic things, but this is all the equipment and supplies that we have to organize, make sure we have cords and that are charged and ready to go just to go on a short trip. So if we were to ever have to evacuate for some reason, like this is the stuff that I have to ensure we have ready to go and collected and organized in a way to relocate somewhere else. So it doesn't work to say have a go bag like most emergency planning and preparation tells people. We also talk about, checklists. Checklists are really helpful for the basic things, but I think we as families have to think about our own internal checklist of what are the priority things that we have to be thoughtful of if we do have to evacuate, or if we are losing power, or if we are affected by anything that could impact our ability to continue to manage care in our home setting for our loved one. There's some things out there, some states have different rules and statutes that if it's a known disaster, so a hurricane or major weather event, if the state's able to issue a declaration, sometimes they'll have it in place that you are able to go get extra prescriptions filled ahead of time so that you can have extra supplies. We don't necessarily have a flexibility built into like the Medicaid law or insurance law yet for DMEs, but while we work on that, I think it's always important to ask and to elevate that need on how can you help ensure if you are in need of extra DME supplies in anticipation of an event. thinking about the best way to organize your supplies, thinking about the best way to transfer your supplies. Um, if you have to leave quickly, making sure you have all of your documentation and paperwork, and just where would you go? And I think for us, it's always thinking maybe having a few different options in mind depending on who all may be affected. So when we think about like challenges and opportunities with disaster preparedness for our population, obviously prescription medications come to the top of the list sometimes as really challenging, especially for those of us that may have compounded medications. One, a lot of compounded meds have a 30-day shelf life anyways, and so being able to stockpile excess of that is really not practical or realistic. The other thing is the ability to find pharmacies to compound can be very limiting depending on where you are. And so, if for any reason the disaster affects your compound pharmacy, do we know a backup that's going to be able to fulfill those compounded meds for you if you needed? We also know if there's any interruption to power, we have challenges with medications that are refrigerated. In our situation, and I know other families may have like access to specialty pharmacy, specialty meds, or home health infusion. So we get monthly IVIG infusion. So that could be interrupted if we had to relocate. How do I ensure that we get the delivery of our medication and supplies? Will our home nurse be able to come and administer that infusion wherever we are? And then we always know that we run into sometimes those continued required prior auths for our meds. And, sometimes those things arise even in disasters, and the system doesn't know how to respond to that and apply any flexibilities that may be in place due to a declaration. So we as families, because we do this every day, may have to be prepared to elevate and advocate stronger to ensure that we can get access to those meds, even if a PA is a potential barrier. And then I think the DME supplies are our second highest issue. Again, most of us that have DME supplies through insurance, we are limited with the amount that we're allowed to have every 30 days. And depending on the DME supply, it doesn't necessarily mean you get a quantity of 30 or 31. And so we have to be thoughtful of how do we stockpile or build up a surplus of these supplies if we're limited on our everyday quantity as it is. And I don't know about any of the families on the call, but I know in my situation, I have 3 different DME providers for our enteral feed, our ileostomy supplies, and our continence supplies. And I can tell you that they come at different times of the month. So I don't get all 3 at the beginning of the month or the end of the month. They're kind of spread out through the month. And so depending on when a disaster may or may hit, I'm kind of at the mercy of where am I on that supply? Did I just get a delivery and am I good for a few weeks, or am I at the tail end and close to my next delivery and now I'm going to be short? And so I think being thoughtful of that and maybe talking to our clinical providers about, what do we do? What are our options to get some expedited supplies of DME if we know a disaster is coming, or if we are unexpectedly displaced? How do we ensure that we're able to get those supplies wherever we may end up having to be relocated? So when I think about helping families, I really go back to, traditional or multiple versions of prep checklists that are out there may not feel very doable for us. I personally look at them and think, yeah, that sounds great, but like it's not a problem for me to have batteries and a flashlight and a radio. My problem is the medications and the supplies and the power source. And so really honing in on how do we talk about those areas that are the most critical for our families, and how do we identify the supports and resources that may be there. And if they're not there, how do we then have those conversations with what do the families need to be prepared to expect before, during, or after? I think always communicating timelines and process for your prescription refills and your prior authorizations. I've started instituting with our primary palliative care doctor that at each of our visits, we go through her list of meds, and I note when our prior auths are coming due for specific medications, so we can start getting things in process so we're not caught after the fact, right? It's hard on a good day when you go to refill and it comes back and says the prior auth expired, and now you know you got to start that process. But I can't imagine exponentially the challenge that would create if we were in a disaster and that happened. I think being mindful of reconciling the medication list that's on file and the pharmacy information to ensure that everything is accurate, because if you have to transfer that to a different pharmacy location for some reason, just making sure that everything is clean and up to date as possible. And then I always say, like, we're really prepared, and families like ours are really good at navigating hard, but we also have to be thoughtful about meeting them where they are in the moment. And sometimes it's just the day to day can be extremely overwhelming. We also don't want to start throwing out, well, all of these disaster scenarios, and have you thought about this? And then we're leaving with a checklist of 10 really large things that now we have to think about on top of that. So, maybe helping to talk through these things a little bit at a time and building on that capacity is usually really helpful. So, with that, I wanted to kind of share a little bit. And I know we were going to have another panelist. I think she unfortunately was unable to join us tonight. So, you're going to get just myself and Bernadette. But I wanted to kind of throw out some discussions and allow Bernadette to kind of share some real life experiences being in Texas and having endured some of the hurricanes as well as the severe freezes with her situation, and just talk about what that looked like. And then, hopefully, if you all have questions and thoughts or comments or things that you've learned, please feel free to put them in the chat. Um, but Bernadette, I kind of wanted to start off and ask, as you've had to prepare for some of the upcoming, weather events that you knew with your daughter's situation, what kind of briefly, what were your top pain points in feeling like you could adequately get prepared for her? Like, what areas were the hardest for you in preparing?
I would definitely agree with saying the DME was very difficult. And at that time that Hurricane Beryl hit in July of 24, it was over 100 degrees. And so knowing that, okay, we needed DME that we were not used to having as well was also challenging, because we didn't have a stockpile like you had mentioned, so we weren't able to hoard it because her airway was evolving, and she was undergoing several different procedures, and so every time we came home, it was a different challenge altogether already, and new DME. And so, like you said, not having the DME and not being able to readily get it, can't get it at a store. And that was a very, very hard challenge, knowing that, okay, a natural disaster is going to hit us.
And can you share briefly, like, what did you do in that? Like, how were you able to try to get that resolved to the best of your ability to have what you needed for that event?
Sure. So as you mentioned, we too have, a different DME company for the different needs. So we had to change actually wound care supply company because of the specialized item she was needing when after her most recent surgery, which was a 10-hour airway surgery just a month and a half prior at Cincinnati Children's Hospital, when again, we are in Texas. So there were a lot of challenges in that altogether too, because DME is different in Cincinnati than it is in Texas as well. So we were already having a hard time getting just things that were the same that we knew that worked up there. And so having a different company that wasn't even servicing us yet, we reached out to, we were going to like a wound care specialist at that time to help with the surgical incision or the surgical care needs. And he basically called every Texas children's wound care clinic and said, how much of this dressing do y'all have on hand? I have a parent that's going to come around, and I went around to 4 or 5 different Texas Children's Hospital clinic locations to gather the supplies that we needed. And then he also connected me with the local rep for our area for that actual specialized dressing that she needed. So that was obviously pivotal because that was the only way we were able to get those supplies for her specialized or for her surgical care needs at that time.
Yeah, how stressful, but how resourceful too, right?
Yes.
Yeah. And while you were, so now you've kind of come into the time of the hurricane hitting. What would you say was kind of your biggest challenge in navigating during the disaster episode?
Sure. Of course, for us, it's already over 100 degrees in July anyway, so it was the heat, and especially when you're dealing post-surgical. So having humidity, heat at a trach or airway site where there's bent area already, it's just a combination of a disaster, anyways. But the heat was definitely, and the humidity was the hardest part. As you had mentioned, you're constantly preparing for emergencies every day. So we did have a small portable generator at the time ahead of time. That was enough to power a portable air conditioner unit for one room, our refrigerator for medications, the ventilator. So we would alternate things like that because, again, it was just a small portable generator. So that and having the small portable generator ahead of time, as well as a small, very small portable air conditioner unit that we had bought from Walmart, knowing that the heat was going to be a very big problem for her healing. Of course, it became apparent that, okay, well, this is lasting a lot longer. Not having air conditioning for 3 or 4 days we were prepared for, but not having it for nearly 7 and on days was something we were not prepared for. So we had enough gas on hand for a couple of days, because usually during our other natural disasters, electricity is usually restored quickly. And at that time, it was, day by day, we were nearing 7 days. And so every day it was a search for gas, to power the generator. So that was a challenge that we were not actually, prepared for at that time. And now, of course, we include that for our natural disasters in the future, is to have more of gas readily available on hand.
Thank you. Yeah, I think that's another thing that we have to be thoughtful of too, is some of the things we require are already hard to get on an average day. And then we know that generally speaking, during a disaster, the things that are kind of we take for granted, like gas or power or different things, become very scarce as well. And so we're, everyone's looking for that. And so that even poses a harder challenge, because for our individuals, it could very well be a matter of life or death to have that. And then you're having to go out and scour to find those as well. So
Right. And in your mind, you have gone through all this, so you're like, we're very well prepared because we have these items, we have all these items, but you don't expect the duration. And so that really did catch us off guard for this, for that natural disaster.
Yeah. Do you have any best practices that you've learned or kind of figured out, having gone through a few of these things that you might share, kind of like a before, a during, and an after?
Sure. I think one of the biggest things, because yes, we are very accustomed to the daily emergencies, and for us, it was airway. So we had run through so many different airway emergencies, CPR, unfortunately, just a lot of things like that. But you have run through all the different scenarios and you have talked about those scenarios. But when you have things like natural disasters, for us, snow, had 4 days of snow was unheard of here in the Houston area. We were familiar with hurricanes, but definitely not when you have a child that has just undergone another 10-hour, her third 10-hour airway surgery. So talking through it, I think, and not just saying, oh, what would you do? But having, here's what I'm going to do. Here's what you're going to do. Here's how you're going to prepare. Here's how I'm going to prepare. And then also we decided and I'm glad we decided to have a family member that was very familiar with our daily routine, also hunker down with us for that, because you need a runner, quote unquote. And at that time we did, because we had to look for gas for the generator every single day. And that was over 3 hours every day looking for that. So that would have been me at home caring for my medically complex child, as well as her sibling, and, changing the generator stuff and doing all of those things to maintain what we're doing. So having a third person ahead of time was a game changer for the hurricane, because usually we're just like, okay, we know this, we know our routine, let's not add any chaos to it. But that was a big difference. Again, talking through very specifics and knowing what every person's role was, including that additional person that we added ahead of time. And then also letting our complex medical team, but mainly her surgeons, because she has such a unique airway need, that we were coming back and forth between Texas Children's and co-care with Cincinnati Children's, that letting them know ahead of time what we were going to do and have open discussions of what do you recommend, and okay, if here's what we're faced with, and just having that collaboration ahead of time. And what came out of that open discussion was okay, here is who, if you stay in your local area and you're unable to evacuate, here is the name of an ENT surgeon that is going to be able to address your child's complex airway needs, especially post-surgically. So having a contact person ahead of time that we kept on, on our speed dial, basically, that would be able to address my daughter's airway challenges in the event that we were unable to get to our home hospital, was obviously a very big preparation, and much needed, because unfortunately that was a call that we did have to make. So thankfully that was in place ahead of time.
Yeah, I think that's a great idea. I think some of us are so used to, even when we're in the hospital setting, right? We kind of have our go-to people that help us, like who's bringing you the coffee and the food and the and so I think it's really important to think about that as well, in this scenario too, is including our village, if you will. So thank you. Just briefly too, I wanted to just touch on, we had kind of talked a little bit with our other panelist, Marcia, about Texas Children's has a pretty amazing sheltering model at the hospital. I think Boston Children's also has something similar, and there may be other children's hospitals that have similar. It's not very common, but I think one of the areas we run into a lot of challenges with our population is the idea of shelters, of where we go, and every state is very different. Some states set up what they call medical shelters or special needs shelters. Some states do not. And so I know that, there's a lot of discussion around how do we ensure that we have sheltering options if families like ours do have to relocate. And so I think it's just really important as families to kind of look into that where you are and what is available, and would those options work for your situation? And if not, you need to be thoughtful about then what does that mean and where do you go? And sometimes just having those conversations will continue to highlight the gap and the need at that local community level. And we hope that that might spur some changes to expand and incorporate shelter possibilities that do work for some of our more medically complex families. Um, Another quick closing thought I thought I'll add, and then Bernadette, if you have anything brief you want to add as well, is I think really reaching out to your local fire and EMS agency that, you probably know them well already. They imagine some of our families utilize them, they respond to our homes, but having these conversations with them as well, and what role can they play in helping to know that you're there to help before, during, or after. And I think there's always opportunities for them to kind of be part of that village for our families as well. Again, every agency functions kind of differently. And so I think it's always good to have those conversations with your local and just find out what that does look like, or if it doesn't exist, what could that look like, and could that exist within your community? So, um, Bernadette, do you have any last quick closing thoughts before we open it up to our Q&A?
I'll add to what you just talked about. Coming home from the NICU, that was what we were told to do too, is to contact our local fire department and police station, and we did that. And I honestly hadn't thought about it again. And during that time that we notified them, of course, told them what my child's medical background or medical considerations were, and told them that in the event that we were unable to evacuate because of a natural disaster, we have a one-story home. So if we had, usually it's water for us, usually it's hurricanes. So if we had high or quick flooding, that our family would be in the attic above the garage. So we had told them that to notate that, that that's where they would find us, because the cell phone towers tend to go down in our area, and there's not the ability to check, because one of the natural disasters I did, whenever power and cell phone coverage was restored, I had voicemails from the fire department saying that, okay, they were going to come and check on us, and if they could not locate us or didn't hear from us, they were going to check the attic. And so they had all of that information still, and I honestly was shocked because I'd forgotten about that call. So many things had happened in those 5 years or 4.5 years at that time. So it actually works. They actually do take that information down. So I was thoroughly surprised by that.
Great, thank you. And then just quick here, I won't read it to you, but just some thoughts of thinking about opportunities and innovation with disaster preparedness that I think we could all work on, families, providers, emergency management folks. And then, yeah, thank you. And I will stop sharing and turn it over to you, Chrissy, for the Q&A.
Yeah, thank you both for all of that rich information. There is a chat that's been bubbling, and I hope that we can respond to some questions there. And all of you who are participating this evening, please feel free if you want to ask live. We love to hear your voice. I will start with a question. Dawn, I loved the family care map image. And I guess my question for you is there an opportunity for families now to call those agencies, organizations, or people in each of those domains and say, what happens if there's an emergency for fill in the blank, whatever it is that you support our family with? Like, do you recommend that? And how do you triage who in that map you begin with having those conversations with?
Yeah, I think that's a great question. So I think that that's going to look very different depending on where you are. I will just tell you from my own personal experience, obviously having the privilege of working in this space, I work somewhat closely with our statewide emergency planning structure. And I started there first. So I kind of went through my care map and they operate on what's called ESF functions, right? And so there's all these different functions and responsibilities in how emergency management works. And so I wanted them to help delineate for me. So when I need help here, who's doing that? When I need help here, and surprisingly or unsurprisingly, it showed a real gap that they, as the statewide planners and those that are responsible for ensuring the response and readiness during this, are not always engaged with those areas. And so I've been working to like I said, expand the table, if you will, to get more of those individuals involved in that. But in the meantime, I personally have been reaching out for my own situation with my daughter to say, well, what happens if this? And the shocking part is a lot of them don't have an answer because that's not something they think about. They're not engaged. Like everybody's supposed to have some sort of an emergency plan, if you will, but it varies in how it applies to those that they serve. So they may have an emergency plan for the buildings they work in, or the staffing, or addressing the needs for the organization and the entity, but they don't necessarily have emergency plans in consideration for the individuals that they might serve. So your health plans or your DME companies. And so um, I would say feel free to reach out. I would say I don't know that you're necessarily going to get the information that you're hoping for. I think you may find that they won't know how to answer or support you, but it doesn't hurt to elevate that as a need. And I always think it's good to kind of push from both sides, right? Like asking the emergency management realm to engage with these, and then asking these entities to realize they also should be engaging. So,
Mm. Naomi has put some ideas and questions in the chat, and I know that she experienced a hurricane in her area last year. She asks, what states are doing disability emergency preparedness planning well? She's been working on this topic for 13 years off and on and hasn't made much headway, any headway.
so what I will say is there's several states that have done a very good job at engaging with what is called the access and functional needs population. So it's very much around disability. So, and a lot of it is centered around like the adults with disabilities. So, like your independent living centers are very, very active in the access and functional needs area and being inclusive in emergency planning, etc. Unfortunately, there's a very different vision and idea, like ideology sometimes in the independent living realm of access and functional needs than like families like ours. So they're very much about we live in the community independently. Oftentimes they push back on some things because they feel like we don't need to be saved. We just need you to have things accessible for us to come in and we can take care of ourselves. And that's great and that's valid and that is important. But we often don't think about families like ours, whether it's children or young adults or even adults, where they live at home, but they don't live at home independently, right? They live at home with like a hospital at home model. And so there often hasn't been a lot of considerations and planning efforts around how do we meet those needs. The unfortunate thing is the assumption is the medical and hospital community will meet the needs of our population. But then on the flip side, we have the medical and the hospital community saying, don't come to us during a disaster. We're affected. We're at capacity. We're surge. We're in contingency or crisis standards of care level. And so I do feel like we're at a time where I am working very diligently to raise that issue to say there has to be a broader understanding of access and functional needs in emergency planning beyond just the independent living disability community. So.
Thank you. And Don, you raised hospital response, and you've, I think, highlighted a compare and contrast here, noting that some hospitals have kind of robust plans for these disasters, and others are sending these messages like, we may not be able to support your family, or this is not the place to come necessarily during these times. And so families may feel like they're stuck between a rock and a hard place. And I think, Bernadette, you shared this story as well, that you're at a decision point in terms of where are we going to go and where do we feel safest in circumstances that are not ideal, right? Every possible outcome doesn't feel so ideal. One provider asked, Dawn and Bernadette, you can both please respond to this. They noted, I work with pediatric palliative care and hospice. What would you like staff in these organizations like these to know? How could we be the most helpful to families before, during, and after disasters?
When I think about our palliative care team that we are under the care of, I think about their coordination of care so greatly, and they just have their ability to coordinate among just obviously the multidisciplinary team, but in a way that is effective and quick. So when I think about natural disasters and utilizing our palliative care team, I think that would be a great tool to talk about. Okay, do y'all know of places, like we were saying, if we have to evacuate or if we have to go to a shelter, are there specific places that would be better or more compassionate for the needs of whatever, like versus if it's palliative care or end of life or hospice, is because some of the places to evacuate are not going to be, thinking about end of life. If I had a child with end of life needs, I would not want to necessarily bring them to XYZ at the convention center, where they'll hold like a big Red Cross, facility. So when I think about our families that we have known that have lost their children, and I can't imagine during a natural disaster too, because the lack of support, but also the environment of how that is happening. So I think that if there was a way to provide information about that, of, okay, if these families have to evacuate, especially end of life families, here is a place that can best support that environment. And I know Dawn has talked about the medications part as well, that obviously with the palliative and end of life considerations when regards to medication for their comfort, being able to collaborate and assist to provide that ahead of time or even during or after. Obviously, I know there have been some families that have shared, man, they had their palliative nurse running around with oxygen tanks during a natural disaster, bringing them, just knocking on everyone's door saying, who needs a tank? How are you on your oxygen? And so I think about families that have shared stories like that and how that really just impacted them. And I've held that, and we've not been, in an end of life situation, definitely still in palliative, but, obviously in a hospice situation during a natural disaster, I think that would be a big resource to have.
And I would just
What do you think?
having the conversations, like as you're having the conversations with your patient and families, is if you know you're in a high risk area and you know that there's a chance that this could be happen, something like this could happen during this time, is asking like what would you need if something were to happen? How can I support you? And then, I think right now the challenge I find is the healthcare delivery side isn't necessarily a go-to contact during an emergency or a disaster, right? We often don't have the direct access to our providers outside of a portal to message.
Mhm.
And so I really am challenging the notion of, I think we need our clinical teams to figure out a way to allow to have that connection and access during a disaster to help support the families with those really critical medical and clinical needs that are not going to be met by the traditional emergency management supports.
Are you thinking like a satellite phone, or what are your?
Yeah, I mean, then we get into that, right? Because if you don't have cell and you can't text
Yeah,
or you don't have, right? I mean, I think those are all the things that, we do need to think about and have discussions around.
yeah.
So,
Because we have looked into that as well, like looking at satellite phones, because of what happened with us too, and also to be able to reach out to other families, like we've all talked about is, and what I'm reading in the chat is that everyone's supporting everyone during the natural disasters, whether that's with supplies, that we know that are common for the vent and the trachs and those things that and the feedings. I think that would be great for supporting each other too. So wish there was a way to, whenever things like that are unavailable, having some kind of satellite phone, or it was just something I had recently looked up when I was looking up how do we communicate when everything's down.
Bernadette, I was thinking earlier when you shared the story about this was soon after your daughter's surgery, how you had a physician that called different locations asking for um, what you needed, and I was thinking that person was such a champion for you in that moment, and I think that's something else that providers, especially in the palliative space, who serve that role anyways, oftentimes, how powerful that was to have someone making calls on your behalf during that time, knowing exactly who to call and exactly what to ask for, and how helpful that could be to a family as they're preparing. I really want to thank Dawn and Bernadette for your time this evening, your expertise, and also just your candid sharing about this topic. There's much to be learned here. I think that's clear, but there's a lot of learning that can be done from one another, including the two of you. So thank you both for coming.